Hi everybody, it's Adam with HeartValveSurgery.com, and we are at the Heart Valve Summit in Chicago, Illinois. I am excited to be here with Dr. Steve Bolling. Steve, thanks for being here.
Hey Adam, thanks for having me.
So you know, Steve is the director of the Mitral Valve Center at the University of Michigan. And we've got a question for you, Steve. We're hearing a lot of great things here about mitral valve therapy. One of the hottest things I'd say we talk about is percutaneous or transcatheter mitral valve therapy. Can you share, just for all the viewers out there, what's the latest updates in this area of valve therapy?
Well, we're very excited about percutaneous mitral valve therapy. It's been an interesting journey for us. Obviously, aortic valve percutaneous therapy has really come forward and blossomed, and TAVR is a reality. It is a therapy for patients. And of course, that recreates the gold standard of aortic valve surgery, which was to replace the aortic valve. We can do it either surgically, or now we've learned how to do it through a catheter. And of course, how you get it there doesn't really matter. The patients do well, and they probably do better because we're doing it with a catheter.
Now, Steve, to interrupt you, transcatheter, can you just define for those folks who've never heard, what does that mean and what are the potential benefits for patients?
That usually means going up some type of vein or artery, and therefore you don't have to go on the heart-lung machine, and you don't end up with a very large incision through your chest or through the side or something like that. But it's interesting that the mitral valve, the gold standard for mitral valve surgery, may be a replacement, may be a repair, and of that repair, there may be a ring, or I may do something to the leaflet or something to the cord. It's far more complex than the aortic valve realm, where replacement is the gold standard. So it's been slower for us to get percutaneous catheter-based therapies because there's so much more to do, but I think it will come. And I think it'll help patients.
Right, and so could you talk about what we're seeing in terms of transcatheter mitral valve replacement, where it is in its evolution, and also transcatheter mitral valve repair? Can you talk about where that is too?
So, of course, in repair, we do have one device, the MitraClip, that is clinically available for transcatheter repair. And what it does is clips the leaflet together. Now, is that going to be the end-all and be-all for everything? No, it does not recreate the gold standard of what I do in the operating room for mitral valve repair of 10,000 things that I might or might not do for a patient. Replacement, percutaneous mitral valve replacement, is really in its infancy at this point in time. And I think, however, that we'll see the same sort of a realm or milieu for the surgeon or the interventional person to pick from, either replacement, a ring, and some type of leaflet procedure. We will have that eventually, the pick of those sort of three things. That's what the gold standard is surgically. That's what we will recreate percutaneously with a catheter.
Well, it's fascinating that you're coming up with, you and your team and the great industry sponsors here are coming up with these options, it sounds like, for someone like yourself to help a patient who's been diagnosed with severe mitral disease. And on behalf of all the patients out there, Steve, you have been working at this your entire life. We just want to say an extraordinary thank you to you for all the great things you're doing. So, Steve,